receive the premium assistance monthly. Okay, it can be applied immediately if you're buying this plan, which I think most low-income people will do. Most low-income people don't want to front the money for an expense for even a medium price plan and then get paid back at the end of the year. So you can do that. You can just have it paid for monthly, or you can choose to receive that tax credit at the end of the year when you file your taxes. So if you're not due back any other tax return, is that your question? Like,
well, you have about $16,000 a year in the example. So I'm thinking there's a standard deduction, which is $8,500 a year. And then let's say someone has IRA or Roth IRA, not a Roth IRA, but a regular traditional IRA, and that's like, what's the limit now, 3,000 or 4,000? So we're getting up to maybe their taxable income is $5,000 a year. How much taxes, how much income tax are they paying on $5,000 a year? And they'll be in a 10% bracket, so maybe they're paying $500 a year?
I think generally when people are very low income like that, a lot of times they just get tax returns. They don't pay at the end of the year. So their return would be larger than what it would normally be.
Assuming that the employer deducted their income tax, which most employers are obligated to do. But it's still, you know, let's say that after their standard deduction and their IRA, their total income is, their taxable income is now $5,000 a year. So how much income tax do you pay when you're in the $5,000 a year bracket? Like nothing.
Yeah, because I believe you have to make $10,000 to even file. Yeah, so that's a pretty detailed tax question. Again, I would call the Covered California hotline and ask, because I don't have a really clear answer for you.
And then my other question is about savings. Is that counted at all?
Nope, they're only looking at income for who qualifies for assistance. Yeah.
Black and white answer.
Yeah, that one's a little easier. Yeah, they don't look at whether you own a car or a home. They're just looking at income. Yeah. I see your hand up, but I actually need to take off kind of quickly, so I'm going to save more questions for the end because I want to show you guys the actual copays for this person. So if we click on View Plan Benefits, we can see that that $5 a month plan has no deductible. Preventative care is no cost. A primary care, this is a normal doctor's visit, it would be $3. Specialist is $5. Urgent care visit is $6. Generic medication is $3. These are just amazing numbers, really. We can see down here, emergency room copay would be $25. And if they had some kind of high cost or infrequent service like surgery or hospital stay, they would be asked to pay 10% of the cost of that. The other thing that we need to look at here is that the maximum out-of-pocket for one person is $2,250 for this person making $16,000 a year. So they would not be required to pay more than $2,250. If their copays started adding up to this number, after they hit it, the insurance plan would pay 100% of all of their healthcare costs. So I'm also going to show us here, they had the choice here between silver plans. They could choose any plan they want. But let's look at the bronze plans just to get a sense of the difference between the different levels. If we look at the bottom numbers here, we can see these plans only cost $1 per month. In fact, they should be free because you can see the premium assistance is equal to the actual cost of the plan. However, there is a law that says people cannot get these plans for free, so they're asked to contribute at least $1 a month for the plan. If we view details here for a $1 a month plan, we can see that there's a much higher deductible compared to $0. There's a $5,000 deductible for this bronze plan. Their preventative care is no cost. This plan actually is a little bit better than some of the other bronze plans because if we look here at the primary care visit copay, even though it says $60, normally you would have to pay the first you would have to pay $5,000 before you paid the $60. But see this little 2 here? This is very important for people choosing between bronze and silver. If we scroll down to the bottom, the 2 refers to this information here, the fine print. The first 3 visits each year are not subject to the deductible. So that means this person has 3 doctor's visits per year at $60 per visit, and they don't have to pay their $5,000 deductible at all. So, for example, me, I generally go to the doctor once or twice a year. Something comes up. Maybe somebody gets bronchitis or there's some minor infection and you need to go. You don't want to have to pay $5,000 or the full price, right? You can get a doctor's visit for $60. If I scroll down, you can also see urgent care. There's 3 visits of urgent care for $120, and you can see for this bronze plan, the maximum out-of-pocket is higher than $2,250. It's $6,350, and again, they're paying $1 a month for a bronze plan. Although $1 compared to $5 is not that big of a difference, but you can see most of these other silver plans were a little higher. So these silver plans costed $45, $46, $53. And this was just a special, really affordable one. Anything else that I want to say about that? No. I think I'm just going to go back to the slideshow.
It's on the side. Just click on that side. Yes.
Yes, thank you. So when people apply to Cover California, they're going to be asked to provide this information, their social security number, information from their W-2s and their income taxes from the previous year. And it's pretty easy. A lot of times people won't have to mail this information in. They can just have it in front of them and read it over the phone when they apply. And the enrollment counselors will the computers will electronically verify the information with the IRS and with like 5 other huge government agencies. But some people, there's special scenarios where they have to mail in information, like with residency and things like that. But generally, the process is streamlined. As far as enrollment already began. It began October 1st, and open enrollment will last until March 31st. So people have until that date to get health insurance and not have to worry about paying any penalty. After March 31st, the next open enrollment date will be October through December. Every year, it's going to be normally October through December. So let's say in June, somebody hasn't gotten any health insurance and they want to sign up. They're not going to be able to sign up for a Covered California plan because it will be closed enrollment. The only way that they could sign up during closed enrollment is if there's some kind of special circumstance. For example, if they lost their job and then as a result lost their health insurance, that would be a qualifying event for them to be able to sign up. Also, we can see up here if they got divorced or had a child or something like that. I'm going to save questions for the end. And good news is that Medi-Cal applications will be accepted year-round.